This question states, which of the following is not a standard patient identifier used in a clinical setting? So it's important to pay attention to the bold not. So as a reminder, we are looking for which answer choice is incorrect, meaning that the 3 choices that we are not going with will be correct. So let's take a look at the first option, medical record number, the MRN. So this is often considered the most protective or the most accurate way to identify a patient in a clinical setting because it is unique to that patient and they are the only one who will have that record number, their name and their birthday. Someone else in that office could have the same one, but the MRN is very unique to that patient and therefore is seen as a very standard patient identifier in a clinical setting. So since that is correct, remember that we need to eliminate it because the question is asking not. Option B states social security number. Now, the social security number is also a unique code, just like the medical record number. And yes, that is a number that is unique to that patient specifically. And therefore, maybe in the billing department, maybe in certain situations, they will use a SSN, social security number, to identify a patient. However, the question's asking about the clinical setting. And often when we ask a patient for information, such as what's your name, what's your birthday, it's stated out loud, and it's not considered appropriate to be stating your social security number out loud in the setting. It's a very private number that we shouldn't really be openly discussing with the patient clinical setting. So in this particular case, no, that is not commonly used as a standard patient identifier. However, in this question, remember it's asking which is not a standard patient identifier, and therefore this actually is a correct choice because we are looking for which is not correct. So we're going to go with option B for now, but let's take a look at option C and D. Let's take a look at option C. Option C states your date of birth, which you might also know as your birthday. And this is, in fact, a very common patient identifier. You might often hear in the clinical setting telling a patient, would you mind just confirming for me your name and your date of birth? And this is used as a quick way to identify that you have the correct patient. And since this is a standard patient identifier, and the question is asking which is not a standard identifier, we can eliminate option C. Now let's take a look at option D, your full name, which is your last name, your first name, maybe your middle initial. And this is also a very common patient identifier to ensure that you are with the right patient, you're identifying them correctly. But once again, the question is asking which is not a standard identifier, so we can eliminate option D as well. And that leaves us with option B, social security number, not a standard patient identifier, and therefore the correct answer to our question.